Hello. A variety of spacer devices are available to help people use a metered dose inhaler. This video will show you how to give your baby or child their inhaled medication with either a Space Chamber Plus spacer or a compact Space Chamber Plus spacer and a mask. These two spacers work in exactly the same way, but the compact Space Chamber Plus is smaller. A spacer is an attachment which makes it easier to use a metered dose inhaler, especially if someone finds it difficult to coordinate pressing the inhaler and breathing at the same time. It also helps to get more medicine into the lungs. If the inhaler and spacer are used correctly, your child should have better control of their breathing problem. But if used incorrectly, your child may have poor control of their condition, with the risk of side effects, such as a sore throat or mouth infection. A mask can be attached for people that cannot use the spacer mouthpiece. Masks are always needed for babies and young children. We're going to show you how to give a child their medication from a metered dose inhaler with the Space Chamber Plus and mask. The compact version of the Space Chamber Plus should be used in the same way. Adults that need to use a mask rather than the spacer mouthpiece can follow the same process, using an adult-sized mask. Attach the mask to the spacer. If possible, your child should sit upright or stand up when using their metered dose inhaler and spacer. With babies, cuddle them on your knee or cradle them in your arms. Remove the cap from the inhaler. Hold the inhaler upright and shake it firmly 4 or 5 times. Insert it into the spacer. When you're ready, apply the mask gently over your child's nose and mouth. Make sure that you have a good seal so that none of the medicine can escape. Press down the top of the inhaler to give a dose of the medicine. Hold the mask firmly in place for 5 normal breaths. Encourage your child to breathe through their mouth if they're old enough to understand this. You should be able to see the blue valve move as they breathe, and you can use this to count their breaths. After 5 normal breaths, remove the mask from their face. Remember that once you press the top of the inhaler, the person needs to breathe in straight away. Otherwise, the medicine will fall to the bottom of the spacer instead of going into their lungs. So don't press the inhaler until you have the mask in place and are happy that there's a good seal. If the doctor has told you to give 2 puffs, wait for 30 to 60 seconds and then repeat the whole process again. Remember to shake the inhaler between doses. Once finished, replace the cap on the inhaler to keep dust out. If the metered dose inhaler contains a steroid, usually known as a preventer, make sure you brush your child's teeth or get them to gargle with water after every use to prevent mouth infections. It's important to look after the spacer, and here are some tips. Wash the spacer before its first use and then once a month or sooner if it's visibly dirty. Remove the mask, then remove the base by placing your thumb in the hole, then pulling and twisting at the same time. Do not dismantle the mouthpiece. Wash the parts in warm water with washing up liquid. Do not rinse the spacer and do not rub it dry. Let the parts air dry naturally at room temperature. Washing and drying the spacer this way helps to stop static building up, which can stop the spacer working as well as it should. Firmly replace the base once all of the parts are completely dry. The spacer should be replaced at least every year, but some may need to be replaced sooner. If you're unsure about how to use the metered dose inhaler and spacer, speak to your GP, practice nurse or pharmacist for assistance.